The facial your client books is rarely the facial their skin actually needs. And the only way you'll know that is by slowing down with the intake form. Welcome back, my beauties, to part 2 of my consultation series. And today we're breaking down the intake form because this is where skin transformation truly begins. Now, when clients book online, they're usually just guessing. They click whatever they think sounds good, like a glow facial, acne clearing, dermaplaning, or peels, and that's totally fine, but we are the ones responsible for guiding them into what their skin actually needs. And to do that, I break every intake form into 5 main categories. 1, concerns, which is what they want to change. 2, which is sensitivities, what their skin can handle. 3, health, what's happening inside of the body. 4, lifestyle, how they live day to day. And 5, products, what they're using at home. When you focus on these 5 areas, you'll never walk into a treatment room guessing again. Number 1, concerns, or what they want to change. This is the client's why. Are they struggling with acne, dryness, pigmentation, redness, texture? This tells you their priorities and their pain points. Sometimes what they see isn't the root issue, but it tells you what they care about the most. Category number 2, sensitivities, what their skin can handle. This category can completely change your treatment plan. Allergies, ingredient sensitivities, past reactions, they live here. If someone is gluten sensitive, I'll avoid wheat-based enzymes. If they're allergic to aspirin, I know salicylic acid and TCA blends are off limits. Nut allergies, fragrance issues. This tells you not just what to use, but what to keep off your back bar for that specific client. Category number 3, health. What's happening internally. Your skin reflects what's going on inside your body. Here's where you can catch medications like Accutane, spironolactane, birth control, antibiotics, or steroids. And each one affects the skin behavior and treatment safety. Hormones, pregnancy, postpartum, perimenopause, PMS, all of this gives context for why the skin might be flaring or changing. Number 4, lifestyle, how they live their day-to-day life. This is where we learn what their skin is actually dealing with. Do they work out daily? Sweat and friction can contribute to congestion. Do they wear a mask at work? That explains irritation or breakouts around the mouth. Are they outside all day? Pigment risk and dehydration then make sense. Do they work as a stylist, a nurse, or a teacher? Stress, chemicals, long shifts, it all shows up on the skin. And lifestyle isn't just about where they spend their time. It also tells you how much capacity they have for at-home care. Some clients can handle a 5-step routine. Others barely feel like they have time enough to wash their face. But this helps you match their plan to their real life, not the routine they think they should be doing. And finally, category number 5, products, or what they're using at home. This one is massive because most of the skin progress happens between appointments. Even if they write everything down, I always ask them to verbally walk me through their routine. Clients tend to forget things, use products incorrectly, overlap exfoliants, or underestimate how often they're using their actives. And this tells you if their home care is supporting your work or sabotaging it. Now, once you've gone through all 5 categories, you should already have a strong idea of whether the treatment they booked is appropriate today. Sometimes it lines up, and sometimes it doesn't. They book a dermaplaning because it's a trendy treatment to do, but if they're dry, irritated, or using retinol, we pivot to repair. They might book a peel, but if they're not wearing SPF or they're on medication, that's too risky. We're going to slow that down before we speed it up. Your job isn't to do whatever is written on the appointment line. Your job is to guide them into a safe, effective treatment plan that meets today's skin where it is. And while I'm choosing what we're going to do today, I'm also thinking ahead. What are the next few visits going to look like? When can we introduce actives? And how does home care need to shift to meet their goals? So it's really important that you don't rush this part. When you break down the intake into concerns, sensitivities, health, lifestyle, and products, the whole picture becomes clear. This is where trust starts and real transformation begins. And in part 3, we're taking everything that we pulled from this form straight into the product audit. What they're using at home, what's helping, and what's hurting, and where we begin to course correct. So make sure you follow along so you can hear all about it.